Hey guys, what's up? So I have been trying to decide whether to make this lecture long or short. So anyhow, I decided, since I have covered a lot of the information about homologs and so on in the female anatomy chapter, that I would make this one a quickie.
Well, love.
Let's get started. So, male anatomy. Prepare yourself, ladies. You have not seen, most of you have not seen a lot of this. Men, this is nothing surprising to you, unlike maybe the last chapter. But ladies, you're gonna see some scrotums and penises and so on, things that you may or may not be comfortable with. But again, just like in the female anatomy chapter, all anatomy is beautiful, and if you don't appreciate it, and if you look at it and you don't think that God's creation is gorgeous, then you need to develop some maturity there. All right, let's talk about the penis. I started you off with some drawings and a statue, and we'll get into real pictures. Next slide. Sorry, I'm joking and dying. The penis is gonna kill me. Let's talk about the external anatomy first. So let me pull up a picture of the external anatomy. Okay, so super basic drawing of the penis. What we call the head of the penis is actually called the glans of the penis, and then the neck is where it kind of gets pinched off. So the glans is the clitoris in women. That's the homolog for the clitoris. The shaft is the can't think of a better way to describe it. It's the part you grab. I don't know. I didn't get enough sleep last night. And the root is the very base of the penis where it attaches to the body. Now the penis is, just like the clitoris, goes much deeper than what you're seeing on the outside. So it's not really the root of the penis. The root of the penis is inside the body, but that is what we call the penis, or the root of the penis. Now the foreskin, let me go back to this slide. So you can see on this picture of the statue, this is an uncircumcised penis, which means it still has the top part of the, I told you I didn't get enough sleep last night. It still has the top part of the foreskin attached. Now when you are circumcised, the entire foreskin is not removed. It's just part of it. And so the foreskin, we'll talk about it more later, but it's covering the penis, it's protecting it. There's a lot of debate about whether circumcision of boys is okay or not. It does not cause nearly the extent of problems of female circumcision that you learned about last chapter, but there are definitely some downsides. There's a lot of nerve endings in the foreskin. I should be talking about this in the circumcision section, but anyhow, we'll get there. So it kind of desensitizes the penis a little bit, and it also makes it less pleasant for women during sex because the foreskin kind of causes a spring action over the shaft. This is hard to explain. So, okay. If you've ever given a hand job, on a circumcised penis, there's no foreskin, and so to go back and forth on the shaft causes a lot of friction, can be painful for the man, especially if there's no lubrication, and can be very tiring on a woman's hand. If there is a foreskin still, the foreskin just kind of moves back and forth, and it makes it really easy to give a hand job, and it's more enjoyable for the man. There's no like Indian burn or anything that happens. Yeah, okay. Moving right along. So you've got the foreskin, the glans is the tip, the shaft is the long part, and the root is where it attaches to the body. That's the external anatomy. Now the internal anatomy, we have, within the shaft of the penis, you have three tubes, basically, that fill up with blood during an erection. Okay, so, and the blood doesn't get caught in the shaft of the penis. It just goes to the penis quicker than it's released from the penis. And so then it's like filling up a balloon with water. It causes it to expand, and then you have an erection. So let me pull up a picture. So this is a penis, and I'm sorry guys, this is a penis that has been cut off of the body. I guarantee you the person was not alive when it happened. He didn't feel any pain. But you can see these two things are the corpus cavernosa. This is the corpus spongiosum, and in the middle is the urethra that you pee through. Let me also pull up, let's look at this one, okay. So you can kind of see Shaft of the penis, obviously. So you have the three spongy bodies, the corpus cavernosum and the corpus spongiosum that has the urethra running through it, ideally to the tip of the penis. Although there can be some issues where the urethra actually comes out the bottom of the penis. Again, usually that's not actually problematic. It's just a weird quirk of nature. All right, anyhow, so the blood goes into these tubes that are basically built like a sponge in order to hold liquids, just like a sponge holds liquid. And so and just like a sponge expands when it goes from dry to full of water, the same exact thing happens to the penis. Okay, and that's how you get an erection. All right, so internal anatomy, basically, of the actual penis. You have the two corpora cavernosa and the one corpus spongiosum with the urethra going through that. All right, let's talk more about the fun parts. All right, so more external anatomy. So you know the glands of the penis, that's the tip. So the parts that are particularly sensitive to stimulation, there's three parts. I only have two, but three really. The corona, the frenulum, and the foreskin are the three most sensitive parts of the penis. So the corona is actually the little, it always reminded me of like a Darth Vader helmet or something. I don't know where my mind is today. So the corona is sort of the edge of the helmet. Yeah, so men appreciate that being touched and so on. And then you've got the foreskin. This picture kind of makes it look like it's just a flap of skin that hangs down from the corona, but it's not. It's attached. How do you describe the... We're gonna get more to the foreskin later, okay? I've got some better pictures. So if you are a confused lady, or if you are a man who has been circumcised and you haven't had a lot of experience with uncircumcised penises, we'll get there. The frenulum is this sort of, it's like a bridge of tissue that holds onto the foreskin. And the frenulum will actually be cut during circumcision in order to remove this part of the foreskin, okay? This is also foreskin covering the penis, but this is the kind of springy part that moves back and forth. All right, so those are the fun parts, according to men. So let's talk about the scrotum. I should have warned you, there's like a real scrotum in this picture, sorry. All right, so the scrotum and the testes. The scrotum is just a pouch of skin that holds the testicles inside them. The nice thing about the scrotum is it keeps the testicles away from the body because sperm can only handle so much heat. And if it's too hot, the sperm actually dies. Why God created it that way, I don't know, but he did. So he keeps the sperm away from the body so that they're a few degrees cooler. This is also why like tight underwear or spending too much time in hot water is bad for men because it can kill the sperm. Now it does not produce permanent infertility, but it can produce temporary infertility because you've killed all the sperm that your body has made at the time. The testes are the male gonads that produce the sperm and the sex hormone. So a lot of your testosterone is produced here. If a eunuch is made, we talked about this in the last chapter, I think. So they'll cut off the testes, or testicles, right? And the penis right here. So the urethra that goes down the center, that's still intact. It ends right here, but you can still pee. But all of the hormones, I honestly don't know. Well, I guess they leave the penis because even a eunuch could potentially get an erection because it's not just the testes that produces testosterone. So obviously if you don't have a penis, you can't have sex with the king's concubines or whatever. All right, so anyhow, a lot of nerves in this area. Not as many nerves as the clitoris has, by the way, boys. But ladies, yes, please be careful of these because they can hurt them. All right, the epididymis, it's this, it kind of looks like fat. This is fat right here. But it is like a tubal type of structure, sits on the back of the testes, and sperm matures in the epididymis. So that's kind of like the sperm nursery right there, the epididymis. Okay, so you've got the scrotum, just basically a bag of skin. And then the testes inside. Now, I will also point out that scrotums are shaped all different ways. Sometimes it's very distinct, like you can see the two testicles inside. Sometimes it just looks like one pouch. So there can be a lot of different varieties of scrotum. This is information for you ladies. And another thing to remember also is because temperature control is so important for keeping the sperm safe, You want, if the sperm's hot, then you need to get it away from the body. That's the point of scrotum. But also if you get too cold, then the body will pull it in towards the body, so that, because too cold of temperatures will also kill sperm. And so this is why men are often embarrassed when they like get out of cold water or something, because everything is pulled into the body. But it's a protective mechanism. It's actually a really neat function of the body. So anytime you see a guy, you can just say, wow, that's some neat physiology. Don't say that, don't say that. All right, the vas deferens. The vas deferens is a sperm that carries, it's a tube that carries sperm from the epididymis and then to the urethra so that it can be ejaculated. All right, so let's look at this picture. All right, so this is the penis right here. It's like everything's cut in half. So penis, you've got the corpus cavernosum and the spongiosum, the urethra right there, that little hole. So you've got the scrotum and the testes. The epididymis is the structure on the back of the testes, the sperm nursery. And then the vas deferens is these tubes that come up through the spermatic cord, and it will travel around and then to the urethra so that the sperm can go out. So interestingly, with men, both the urine and the sperm go through the same tube, the urethra. For women, the vagina and the urethra are two separate tubes, two separate openings. So you do not, you pee and you have a baby or menstruate out of two separate openings. All right, I'll also mention that we have the cremasteric muscle, which is what helps to pull the scrotum, well, I guess you could say scrotums, I don't know, scrotum plural? Yeah, I think scrotum is plural and scrota is probably singular. So anyhow, this muscle pulls the testes, pulls the sperm closer to the body to keep it warm, or it relaxes if things are too hot and everything looks bigger. All right, so if you want to impress the girl, make sure it's warm in the room. So, guys, I'm sorry, I should have warned you for this. Vasectomy. This is male sterilization. So, for girls, like, we have all sorts of methods to attempt to not get pregnant. We'll talk about that more later. You know, you can take birth control pills. You could have a hysterectomy or an oovectomy, I believe, when the ovaries are removed. For men, this, like, you have the condom and then, which doesn't work super well, and then the vasectomy, which you cut the vas deferens that we just talked about, remember? Okay, the tube that is going in here, it's kind of inside the muscle, so it doesn't really show it very well, or at all. Okay, anyhow, so this one shows it better. So this is the epididymis, then the vas deferens, which is just a tube for sperm traveling from the epididymis to the urethra. So in a vasectomy, the doctor will go in and will snip the vas deferens, and then they'll just kind of sew off the ends. Now, vasectomies can be reversed, especially if they're not done well. Like a super well done vasectomy can't be reversed. That would be very difficult. But vasectomies can also reverse themselves, so they can do like a natural reversal. If the ends of the vas deferens are left too close to each other, they will actually try to reconnect, which all blood vessels, neurons, things like that, they try to do. So you can see this is an actual vas deferens. They snip it, they usually snip off a pretty hefty chunk so that the tubes are away from each other, the ends of the tubes. Now, if you have a good doctor, he or she will not only snip it, but will actually kind of pull it back and sew it into the wall of the scrotum, like back here, so that they're really pulled away from each other. And then chances are they will never reconnect. So my dad actually had a vasectomy when I think I was a teenager. And my mom used to be a surgeon, and when he went in for the vasectomy, the doctor actually let her do his vasectomy. And that's how she did it. She actually sewed it back into the walls, and she said that he will never, ever have another baby again. So, yeah. So if you have a vasectomy, guys, you still produce sperm. The sperm just can't get out and just eventually dies and is recycled. Okay. All right. Before I go on from that, I'll just add one thing. A lot of men, like, the idea of a vasectomy is emasculating to men, and I don't know, I don't really get that. Like, if you've had kids, what does it matter? Like, you're still producing sperm. The only difference is the sperm can't get out. So I'm not really sure why some men find this threatening. But I will point out to you guys, and girls obviously keep this in mind too, any of the methods for sterilizing women either A, don't work very well, or B, are dangerous for women. So taking birth control pills increases the chances of cancer tremendously. Having her tubes tied, which is literally is the same exact thing, just with the fallopian tubes rather than the vas deferens. And the fallopian tubes reconnect much better than the vas deferens, so it doesn't work well. There's many cases of women getting pregnant because the fallopian tubes reattach themselves. Also, women, if they have their tubes tied, could potentially have an ectopic pregnancy. So that's when the egg will still come out of the ovary, just like you're still making sperm. The egg comes out of the ovary and is now floating around the body because the fallopian tubes are tied off, and it escapes anyways. And the sperm can potentially escape anyways and fertilize the egg, and it lodges into the liver or something, and then baby and mom dies. So really the best sterilization method is a vasectomy. So if you really care about your wife and you've had all the kids you want, have a vasectomy. Don't make her get sterilized. All right, let's talk about the wet bits. So these are all the homologs that you saw in women. So the seminal vesicles and the prostate glands is what primarily produces, and the Cowper's gland. See Cowper's gland for female, whatever. All right, so it's seminal vesicles, prostate gland, Cowper glands. These are the three wet bits. The two primary ones are the seminal vesicles and the prostate. So the seminal vesicles secrete an alkaline fluid, and this helps the sperm to be more mobile. They can move better because they're in this fluid. And this is the biggest part of semen. So semen and sperm, two separate things. Sperm is just the little wiggly bits. Semen is all of the liquid that the sperm is mailed to the woman in. All right, the prostate gland, located at the base of the bladder, produces about 30% of the seminal fluid released during ejaculation. So prostate gland and seminal vesicles basically produce everything that's in semen. Okay, that's the primary thing. The prostate, you can easily get cancer there. This is what men don't like being tested, right? Because it has to be tested through the anus to feel it, make sure it's not swollen or having problems or whatever. Right, also notice in this picture, the urethra goes through the prostate gland. And so if the prostate is swollen, or if you're dealing with prostate cancer, then you'll have a hard time urinating. So anytime a man has an issue urinating, he needs to have his prostate checked. All right, the Cowper's gland. The Cowper's gland is more likely to be like pre-ejaculate. It's located at the base of the urethra, produces another alkaline fluid during arousal. Now, interestingly, the penis produces all alkaline or basic type of fluids, and the vagina is very acidic, and that can kill the sperm. So the penis, male reproductive system, is trying to do everything it can to make sure the sperm can survive the trip up the vaginal canal to the egg. So that's why it produces these alkaline fluids. Right? Okay, I think I talked about semen already, right? Semen is the fluid that the sperm is released in. There's about 1 teaspoon of sperm per ejaculation. It's 100 to 500 million sperm. All right. Okay. Again, ladies, prepare yourself. E is for erection. All parts of and actions of the human body are beautiful, so please don't overreact. We're going to see some actual pictures of erections and ejaculation and so on. It's an amazing physiological process. There's nothing ugly or shocking or crazy or whatever about it. Right? The human body is beautiful. All aspects of the human body is beautiful. Okay, so just be prepared. All right, the erection. The erection is controlled by the autonomic nervous system. So the arteries leading to those 3 cylinders, the corpus cavernosum, the 2 cavernosum, and the 1 corpus spongiosum, fills up with blood from those arteries and causes the erection. Blood can flow out. I'm reading this wrong. Blood outflow cannot keep up with inflow. I said this before, but so there's more blood coming in than comes out, just like filling up a water balloon. It causes it to expand, and then you get an erection. All right, notice these pictures. We have an uncircumcised penis, so the foreskin is still attached here, and which protects it. Also causes more sensitivity, but the foreskin retracts. Sometimes it doesn't retract exactly with an erection, and men or women have to help retract it. But it will look like, basically it looks like every other normal penis when it is fully erect. However, it has like movement because it's like a loose layer of skin over the shaft of the penis. So it's really easy to move it around, and it's everybody's happier. Now, erection happens in infancy. It happens in the prenatal environment as well. This is an ultrasound of a baby boy having an erection. So this happens, if you're pregnant with a boy, it is happening in your belly. It is going to happen with your 6-month-old. It's going to happen with your 2-year-old. It's going to happen with potentially your 1-day-old. It is normal for little boys to get erections as much as it's normal for older boys to get erections, right? And we'll talk more about masturbation later, but pretty much every man masturbates. That's what the statistics say. Is not the case with women. You ladies should not be surprised because there are ultrasounds that look like little boys are probably masturbating even in utero, okay? Or at least messing around with it, which is kind of the same thing. Okay, so we'll talk more about that in another chapter. Now, erections, they come from both psychogenic and there are psychogenic and physiogenic erections. Inputs come simultaneously from both thoughts and physical stimulation. I don't know why this is in the chapter for male anatomy, but it's not in the chapter for female anatomy, because that is also true. Women get turned on by thoughts and women get turned on by physical stimulation, and usually you're getting turned on by both. And we will talk more about this in the arousal chapter, and we'll talk about arousal non-concordance, where you can be aroused without any thoughts of being turned on, or you can be turned on and you don't have any physical signs of arousal like an erection, which is much more common with women than for men. But anyhow, we will get to that also in another chapter. Oh, okay, let me prepare you before we go to this slide. All right, prepare yourself, okay? We're gonna talk about ejaculation, and I have a picture of ejaculation happening. Now, the reason why I want you ladies to see this, men, I know you've already seen it. I have talked to students, female students before, who have said they have no idea what ejaculation looks like, and I think that you should know. I don't think there's anything wrong with actually knowing what it looks like. I had one girl who said that the first time she actually gave a hand job to a guy, she thought that the sperm would squirt like across the room, and that's not what happens. Okay, so I'm turning the slide right now. Okay, ejaculation. So not very much comes out, and it doesn't go very far. It just kind of like blurbs out, and then that's the end of it. Ejaculation happens because of nerves in the spine. It's a spinal reflex, and it triggers 2 phases. So ejaculation happens in 2 phases. The first one is emission, where fluid gathers in the urethral bulb. And then the second stage is expulsion, where semen is expelled. Let me actually look up a picture of the urethral bulb. Hopefully nothing bad comes up. You never know with Google. Okay. Here we go. It's probably the best. Okay, ignore the injury stuff. But so the urethral bulb is kind of right at the end of the shaft inside the body, kind of between the prostate and the wall of the abdomen. There's a better picture. So this is at the very base of the penis, and so the testicles would be down here. So it would travel from the epididymis up the vas deferens to the urethral bulb, and then out the urethra, okay? So when ejaculation is happening, the spine triggers emission, which is all that seminal fluid to go to the urethral bulb, and then expulsion, and that's when the urethral bulb basically contracts and squirts out, because of the pressure from the contraction, squirts out all of the semen through the urethra and not the penis. Now, if expulsion has occurred, a man cannot stop himself from ejaculating. If emission has happened, a man can still stop himself from ejaculating. It is possible. So I guess the only reason I mention this is because there have been some cases where women were having sex and they said they didn't want to have it anymore, and men claimed that they couldn't stop having sex. It's possible, but that would be right at the tail end of having sex. So chances are, even at the very beginning of ejaculation, a man, if he had the self-control, could still stop having sex. But Don't let it get to that point. Nocturnal emission. This is an involuntary ejaculation during sleep. Now we talk about this like it only happens to men. It doesn't happen only to men. Women also have, well, not nocturnal emission, but we have orgasms in our sleep. Okay, so I'm gonna put up a video about erections, and one of the things with erections is that men cannot always control erections, and it's important for women to not freak out about this. And there's many situations where a man is dealing with some intense embarrassment because he just has an inappropriate erection. And again, we'll talk about this more in the arousal chapter, how there's arousal non-concordance. So even a man can just get an erection and he's not turned on, there's nothing sexual going on in his brain, but his body just decides randomly to do it. So it's important to not shame men for something like this, especially young boys or young men. One student told me a story about he was in class and the math teacher called on him to go up to the board and answer a question, and he had just gotten an erection and he couldn't make it go away, and so he had to play it off like he was just some rebellious class clown and he's not going to answer that question. And he said it was just the most embarrassing experience, and of course then he got suspended from school, and you know, it's bad. So I think we need to be a bit understanding, and anyhow, I will post a video for you guys to watch about that. All right, does size matter? I know I made a joke about this in the beginning, and there's so many jokes about it, but this is a really big issue for men. They feel very self-conscious about it, or very proud on the other hand, and there's some truth to that. Like if you talk to a lot of women, some women say if the penis is too small, then it might impact sex. But on the other hand, if it's too big, it also impacts sex. And I've got a picture of a penis later on that is enormous. I will mention that the vagina is only so long. And if the penis is too big, then it's whacking into the cervix of the uterus and can cause cervical bruising and can be very unpleasant. And as a matter of fact, if a man has a big penis, then a sex therapist or doctor might suggest that like you put a towel on the woman's abdomen so that when they're having sex, the penis isn't going in as deeply. Anyhow, so there are all sorts of penises. Penises show erect penises show less variation than flaccid ones. So a lot of guys, if they have a small penis, it's when it's not erect that they're embarrassed. But the truth is, even a smallish penis, when it gets erect, it's usually about the same size as every other penis. Now, I did a lot of research on this before I did the lecture about women's preferences, and it is all over the board. There are women who say it does not matter how small it is, it just matters how good he is at sex. And there's other women who are like, yeah, I like a big penis. So it is a matter of subjective preference. It is all over the board. So if you don't have a giant penis, just find a girl who likes a smaller penis, who doesn't care, and get better at the other parts of sex. Because remember, with female sexuality, the penis is really like, it's not the biggest part of having sex, right? The penis is the biggest part of you guys having sex. But for women, it's the clitoral stimulation. So the penis isn't doing all that much for girls. So who cares what the size of your penis is? This picture here is shoe size and penis size. And you can see there's maybe a small amount of correlation between penis size and shoe size, but it's really kind of all over the place. Like the guy with the smallest shoe size had, you know, a pretty decent sized penis, and this guy had the second to biggest shoe size, and he had the second smallest penis, tied for second place. All right, so, and then in the middle, we also have fairly good sized penises. All right, so, and also when they become erect, you can see there's a lot less variation in the penis size. And then the erect penis kind of evens the playing field for everybody. Also, you can see that there are all sorts of different shapes and sizes in penises. So there's not just one penis. Again, men suffer from this porn perfect sort of stereotype where there's a certain penis, it's usually absolutely gigantic, way too big for a woman to be happy with, generally speaking, at least without some protection from the size. And then men just kind of think that this is what they're supposed to have, and the truth is that's not what they're supposed to have. So men also suffer from body consciousness, and this is more and more of an issue as porn became more easily accessible with the internet and so on. I mean, if you were a kid in the 1940s, the most access to porn you had until you were older was, you know, you could look at the bras for sale in the newspaper and that was your porn. And now, you know, a 6-year-old could get on the internet and see the hardest core porn that's out there. It's really no wonder with all this media that men are dealing with a lot of body consciousness issues that men didn't have to deal with before. So, all right, so ladies, also remember men deal with the same crap that us girls deal with. All right, so just like the vulva, there are all sorts of different shapes and sizes and colors and variations of the penis. If you go through here, you can see circumcised, uncircumcised, circumcised, uncircumcised. This is also circumcised right there. Uncircumcised, 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 probably circumcised, uncircumcised. The uncircumcised penis is kind of the classic one that we think of, but that's not actually what the natural penis looks like. So, also notice the scrotum shape difference, right? And just like our boobies, there's lopsided scrotums, okay? It's very normal. Lots of variation. I should have given a warning for this one. Circumcision. Talked about this before, okay? This is an uncircumcised penis. You can see the foreskin here. This is, circumcised penis. This is an uncircumcised penis. Now, I know I said that when the penis is erect that you can't always, like it can be a little bit more difficult to tell whether it is a circumcised or uncircumcised penis. However, this one, you know for sure is circumcised because right here you can see the circumcision scar. Okay, so this part is still foreskin, but this section of the foreskin was removed and it leaves a scar. A lot of guys, I think I said this in the last chapter, but a lot of guys will say, did I do something to cause this color variation? And no, your parents did, right? Or your rabbi did, or whatever. So why do we circumcise? One is religion, but non-religious reasons, it lowers the chance of infection. So you can see this loose skin here, dirt and bacteria and nasties could get up in there, and if you are not careful enough to wash your penis well, then it can cause an infection. Okay. Also, for some reason, an uncircumcised penis is you're less likely to catch HIV/AIDS. So there are advantages of circumcision, male circumcision. Are there any advantages to female circumcision? No, none, like zero. All right, so on the con side, there are possibilities there might be some functions for the foreskin that we don't know about. It's kind of like the appendix. We have no idea why we have an appendix, but there's probably a reason. Why do we have the foreskin? There could be things that we don't even know why we have it for, and we'll eventually find out. It also alters sexual function. So, like I said before, having sex is a bit less pleasant if you are dealing with a circumcised man because of the springiness of the foreskin. Also, it's traumatic for the newborn. Usually circumcision is done without any painkiller because they believe that, sure, infants would experience some pain, but they'd forget about it because, you know, infantile amnesia. But we now know that even though they may not remember it, it actually changes the neurological system. So the more pain babies deal with, the more sensitive they are to pain as adults. Like I mentioned before, there are a lot of nerve endings in the foreskin. So they say that there is less sexual sensitivity in the penis if you are circumcised. So there are some pros, there are definitely cons. The American Medical Association moderately supports circumcision. They believe that the pros somewhat outweigh the cons. I mentioned this before, the circumcision scar. So uncircumcised penis with the foreskin covering the penile shaft. This is a circumcised penis. You can see the penis, the circumcision scar right here. And then this one is very obvious, the circumcision scar. All right, so let's talk about a few health issues for men's penis and reproductive anatomy. All right, so two big issues, testicular cancer and prostate cancer. Testicular cancer is fairly common, and usually it's diagnosed because a woman is playing with a man's and she notices that there is a change in the shape or feeling of the testicles and is concerned and makes him go to the doctors. So usually it is not diagnosed because a man does a self-examination, although you should. And usually it's not because he went in for a medical check for the doctor. It's usually because the lady's doing her thing. It's important, ladies, to make sure that you play with your man. And then prostate, which men hate, and I totally get. I wouldn't want to have this happen either, although us ladies get fingers stuck in our holes all the time. Deal with it, you just have to do it. So this is when you have to bend over and cough. The doctor puts his or her finger up the anus, and that way he can feel the prostate. And when you cough, it helps, the muscle from coughing helps to push the prostate a little bit closer to the edge of the rectum so that it can be felt better. So anyhow, those two things are very important, fairly common as far as health issues go. This picture right here is a normal prostate and a prostate with cancer. You do not want to die of prostate cancer. It is a terrible thing. You girls, we have way more health issues that we have to deal with our reproductive system, right? Because it's a bit more, it's not more complicated. I'd say maybe it is more complicated because we're also producing a baby, but our reproductive system is used a lot harder. We put ours through a lot of work. You know, we've got ovarian cancer, uterine cancer, cervical cancer, vaginal cancer. I mean, there's all sorts of issues. For us, there's no self-examination. You just need to go into the doctors and you get, you know, your gynecological visit. You are all of the age where you should be having that done probably every other year tops. Okay, so go do it. That's basically it. Told you I'd make this short and sweet, and it's the quality of the lecture, not the length of the lecture, that matters. If you have any questions, message me, and otherwise I will see you in the next chapter. Bye!